Hello, my name is Annalie Martin, and today I'm going to be doing a abdominal assessment. So first thing you're going to want to do is ask the patient if they have to go to the bathroom, because as you can imagine, it would be very uncomfortable to have somebody pressing on your abdomen and just touching your abdomen when you have to go to the bathroom, and it also might, they might appear more bloated than they are. So it would definitely be helpful to have them go to the bathroom first. So you're gonna of course wash your hands, and you are also gonna wanna make sure that you just make the patient aware, give them that privacy before you expose their abdomen, and just, obviously get their permission. So first you're gonna wanna inspect. So you're gonna want to just look at like the contour, the shape, their skin tone, any coloring that looks different. You're gonna wanna look at the pulsations, check out their umbilicus, see like, do they have any rashes? Do they have any lesions? Do they have scars? And if they do, you're definitely gonna want to document that. Now the next step is you are going to auscultate, and you're gonna auscultate first because you don't want to, before doing any touching, because you don't want to mess with their bowel sounds beforehand. You wanna make sure to auscultate before you palpate. So you're gonna start in the right lower quadrant, and then you're gonna work in a clock-like motion. So you're just gonna wanna be listening for like the bowel sounds. Normal would be like 5 to 35 seconds. Hyperactive is gonna be like more than that. Hypoactive is gonna be like less than 5 seconds. So you're gonna definitely wanna make sure that you listen for that. Certain cases, it may be normal that it's low, that it's like a hypoactive, because if they just had surgery, it's very common for it to be lower. If they're sick, you might hear some like hypoactive bowel sounds if they have like diarrhea. Hyperactive, I'm sorry, because everything's kind of going crazy in there. If there's none, I believe our textbook says we listen for 5 minutes at each quadrant, which was kind of surprising for me. Some other sources I saw 2, but I'm gonna go with the 5 just to be the most thorough. And then one thing that I forgot with auscultating is you're going to want to also auscultate with your bell for a bruit. So you're gonna definitely want to make sure that you listen for that. And then you are also gonna lastly listen to their femoral and iliac crest, which is down in the lower, beneath the lower quadrants. And then the last thing you're gonna wanna do is palpate. So you're gonna gently rock your hand over and you're gonna wanna make sure you palpate, are very careful when you're palpating some of these areas, because if it is tender and they tell you that it hurts, you're gonna, that's one thing, part of your documentation. So you wanna make sure that you are careful. You don't wanna go, really, really hard, and just make sure that they tell you if it hurts, but you're just gonna kind of be rocking your hand through each quadrant to, check and see if they have like any pain. And the final thing is going to be make sure that you document your abdominal assessment, especially if there is anything wrong. You're gonna wanna make sure that you document that. Thank you.